welcome to Pints and Pelvic Health. I am Megan Cranenberg. I'm a doctor of physical therapy and the owner of Chrysalis Physical Therapy in Poulsbo, Washington, as well as Crane's Castle Brewing here in Bremerton, Washington. And today I'm joined by a fantastic colleague and a local treasure, and I'll let her introduce herself so you can kind of get the idea where we overlap professionally.
Thank you, Megan. My name's Holly Campbell, and I am a licensed midwife here in Kitsap County. I'm a licensed midwife, I'm a certified professional midwife, and I hold a Master's of Science in Midwifery from Bastyr University. And I am one of the 2 midwives at Salmonberry Birth Center, freestanding birth center here in Poulsbo.
Yeah, the only one on the peninsula, right?
Yes, yeah. The closest birth center is in Tacoma, and then there's several in Seattle.
Yeah, my son was born at the one in Tacoma.
Nice.
We were living down in Gig Harbor at the time,
Oh,
so
very
it was
cool.
just right
Yeah.
across the water.
So we see families from all over Jefferson County, Kitsap County. We do births at the birth center. We also offer home birth.
Cool.
Yeah.
And the birth center took a lot of like kickstarting, a lot of community support.
A lot of community support, and every birth professional I feel like in Kitsap County had a hand in starting the birth center. From the owner, who was a former labor and delivery nurse at Harrison, Julie Bennett, to Melanie Brindle, who's my current practice partner, to Louisa Wales, who was a midwife in the community for a long time, since retired from midwifery for the most part. Doulas, childbirth educators, public health professionals, lots of people worked really hard to get a freestanding birth center here in Kitsap.
Why do you think it's really important to have an option like a birth center for women to have access to?
Well, I think it brings the midwifery model of care into the community. So right now, although there are CNMs that are going to start practicing in Kitsap County, which we're really excited about, but until, and there've always been midwives in Kitsap. There's midwives, or even, on the peninsula, there's been midwives here for a really long time, but all offering home birth. And so the family's options were either a baby at home or a baby at the hospital. And those are big choices on 2 kind of extreme ends of a scale, right? And so as midwifery has in general kind of resurged in the country, and Washington State has always been really progressive in licensing midwives, there was just a growing demand for another option in the county. And what's special about midwifery care versus kind of more contemporary obstetrical care is the focus on the whole person. And the midwifery model of care is actually a trademark model of these different tenets that takes care of not just the physical health of the mom and baby, but the emotional health, the psychological health, offers care for the partner, for the whole family, and it gives people an option that's not home or hospital. So the fact that up until a few years ago, the only places to have a baby in Kitsap were either your home or the hospital. Now there's a birth center, and now we have more influx of that midwifery model of care to a wider scope of families, which is really nice.
Yeah, I remember that was something that personally, when I was looking into, as I was with my daughter, I didn't really have options. We were stationed overseas, and so it was the Camp Lester Naval Hospital on Okinawa, and that's where you had your babies. And it was a Navy Nurse Corps midwife, and so I would say that I was definitely supported through that. And then when I was pregnant with Killian, and we were back stateside, and for me, it kind of boiled down to the thought of that extra option of being between the 2 extremes was awesome. The other thing that was important to me in making that choice to go with the birth center birth with my midwife, who was Susan Sherwood, who now owns Birth Center, the birthing inn, was that if she took me on as her mama, she is who I was going to see through the whole continuum of care, and I really appreciated that. And I liked the thought of being somewhere quiet. Not necessarily my own house, but as a person who's a little bit averse to lots of beeping noises and chatty nurses stations, which it happens, it has to be that way. That I thought, it might just be super peaceful. And it was like showing up to a great bed and breakfast and going home with a baby.
What we like to tell people is that if you're not ready to have your baby at your house, you can come to our house. And have your baby at our house. And yeah, we really love what we do. And I think too, you know, there's a lot about what we do that is the standard of care in obstetrics. You know, we don't really deviate from a lot of the really important things.
No.
Our schedule is the same, the tests and things that we offer are all the same. We just do it in a different way. We have longer appointments. We recognize that the decision to have your baby outside of a hospital means that you really trust your provider.
Yeah.
And so much of what we do while monitoring kind of, are you still low risk? Is your baby still low risk? Is an out-of-hospital birth still appropriate for you? Is that relationship building, that trust building? And a lot of it is education, a lot of it is advocacy, a lot of it is impressing upon the families their role in the relationship. You know, if you want to stay low risk and out of hospital, you have to take your supplements, you have to take your vitamins, you have to, you know, you have to keep yourself healthy, right? Because that's what Melanie and I are professionals in. We are professionals in low risk, healthy moms and low risk, healthy babies. And so part of that plays into a lot of what we're going to talk about today. You know, it's just, I think so many people just go to appointments and don't have a whole sense, you know, don't know that they should have more agency than they do in their care.
Okay.
And I think they just kind of go along with it. And there's a lot of things that we pay attention to that I think other providers wouldn't, because there's solutions for that down the road. You know, we get really skeeved out, right? Or really twitchy when someone's got really low iron. Well, you know, because that's could potentially be a hemorrhage risk, a compensation risk. In the hospital, you can treat all of those things. Yeah. Out of hospital, we have limited tools. So we try to keep, you know, work with people on understanding their body, understanding the physiology a lot more, so that they understand what's happening to them. They have a better sense of their story.
I think that's a neat tie-in with physical therapy too. You know, as I kind of joke with my patients sometimes that I think physical therapists are the MacGyvers of healthcare. Totally. Because I don't have drugs at my disposal. I don't have surgical techniques at my disposal. Yeah. I need to, you know, I do have the doctoral education of understanding, you know, is this a physical therapy program or problem that you're coming to me about, or is that low back pain your kidneys or a spinal tumor or blah, blah, you know. Totally. What else could it be? And so that I know to send you to the appropriate provider. But I think that because we don't always have those really fancy, sharp tools at our disposal, that we become, I think, pretty sensitive to and open to and aware of alternative methods of getting, and we'll talk a lot more about that in probably our third session today when we're talking about rehab side. Yeah. Have you always been a midwife?
I have not always been a midwife. I've been a licensed midwife for about 3 years now. I did 3 years of training. Best Year's a 3-year program. Before that, I was a doula for a long time, but I have worn many hats.
That's not a bad thing. That's not a bad thing.
It's my Master's of Science in Midwifery is actually my second master's degree. I also have a Master of Arts in Psychology, so I was a child and family therapist for several years. Before that, I worked in tech in Seattle, like most young 20, 30-something professionals. When the bubble broke in the early 2000s, that's when I went back to grad school and got my master's in psychology. And was a child and family therapist on Vashon Island for a couple years.
What a great background to have going into midwifery.
There's a lot of intersection. You know, and what I love about midwifery is that it's time bound. So one of the reasons why I kind of started to drift away and not have, I get burned out on therapy is just, it's not time bound. You know, you can see the same person for years, and are you still helping? Is there still growth? And that was really hard for me. But, you know, with midwifery, eventually your baby comes out,
one way or the other.
Eventually, you know, the scope of our care is 6 weeks postpartum, and then hopefully you decide to have another baby and you can come back and see us in a couple years. But then, you know, I'm kind of, and that's just my personality. You know, I know that about myself, is I like to do new things.
I'm with you. I'm a kind of a rare physical therapy practice in that I don't really see people too often. I think because I spend a really good I front load the time. You know, 90 minutes on that first appointment, we kind of dig into what's going on, send you home with a home program that should address a couple things right away. And then maybe I see you weekly, maybe I see you a couple weeks later. I probably only average about 6 visits per patient. And then it's like, okay, go live your life.
Yeah, good luck.
Come back as something else, you know.
Call
and
me
by
if you
that
start
time,
peeing yourself again.
Right.
You know?
If that were the only thing I treated, right? Cheers. There's more to it. But I think that's a really neat segue. We're going to be discussing a lot more in the next couple segments on, you know, I love that we talked about your counseling background.
Yeah.
Because I think one of the things that I spend most of my time dealing with patients is fear.
Yeah,
right?
absolutely.
And how that might relate into the labor and delivery process of fear and positioning. We're going to be talking about childbirth-related injury.
Yeah.
Not only, you know, common types. So that'll be in the next session that we'll be discussing, you know, specific types of injuries that women sustain during the childbirth process or even during pregnancy. And then kind of delve down into, you know, what are our methods of preventing that? What do we understand are the best ways of minimizing that risk? And I'll get a chance to maybe answer any of your questions that you might have as you send your mamas to me on the process of rehabilitating those injuries and getting people, I don't like to say their body back because they never lost it, but, you know, becoming as functional and athletic and happy and sexually active and fulfilled in that new normal.
Yeah.
So,
Yeah.
all
That's
right.
great.
Shall we?
Let's do it.
All right. Well, hey, thanks for talking with me.
You bet.
Bottoms up.
Bottoms up.
All